So our last speaker is Dr. Javed Ismail, who is the Director of Non-Communicable Disease at THC Global. The topic of his presentation is Overview of Grant Writing. Welcome, sir.
Okay, so grateful for the invitation here to talk about this grant writing. So as you can see my name over there, Javed Ismail, I'm affiliated with two organizations. One is PSC Global, which is private research organization, and the other is Shalimar Medical or Shalimar Institute of Health Sciences as a public health specialist. So yeah, so as for my background, I'm a medical doctor way back in the ages of dinosaurs. So, and after that, I got interested in research and did my master's in epidemiology and biostatistics from Aga Khan University. And then did my PhD after being affiliated for so many organizations. So did my PhD because I had an interest of digital health. So did my PhD in digital health and its use in non-communicable diseases. And during that period, I had some experience of writing grants and all those things. So the today's topic that we are going to discuss is about grant writing. Okay, so you may have discussed about research protocols and research and whatever. Now the big question here is to get money to implement that particular research. So that's the main part where that particular grant writing comes in. What would be the objective of our presentation would be to know about what's grant and how to write those grants and what do we mean by grant or funding, and then learn how to identify the right funder, understand how to review grant eligibility and prepare effectively for applying for grant. So different aspect of acquiring and finding out what grant are, what are different organizations are. So I'll be more interested in having some interaction and because I'm that kind of a person which like to interact with individuals. So okay, so do you have any idea what that grants mean? That what's grant? Yeah. Mm-hmm. Mm-hmm. Yes, yes, exactly, exactly. So to define the grant is like, you know, or the grant writing, to acquiring that particular amount of money is a skill or practice of asking for money in the form of a grant from a foundation, corporation, or government agency by crafting a well-considered document which is known as proposal. You may have that outline how the money will be used, what receiving the money will accomplish, and who will undertake the task described in the proposal. Okay, so that's the aim of that particular grant or money. Yeah.
As you said, it should be interactive.
Yeah,
so
yeah,
I just wanted to ask you, is it only the money that is important, or the objective is something else?
Actually, yes, your point quite important, but actually we are talking about the grant aspect of that particular whole thing. Okay. You know, that's the whole process. There are different processes in it. The first processes would be like, I'll be jumping mine. Since it's an interactive kind of a thing, to make it more sequential kind of a thing, we'll jump thing. Since you have asked that particular questions, so what's the most important point in that particular whole cycle of doing research? In the whole process of that particular process of, I'm just deliberately, you know, holding back something. What are the main thing in the whole process? Because acquiring grant is one part of that particular process. You know, you cannot separate it out from that particular process.
If you're asking about the whole objective.
All objective, or let's suppose there's something that you wanted to do, and
it might be, for example, you know, BMJF, it's a big donor, Bill Melinda Gates Foundation. So what they do across the globe, they give a lot of fundings to the third world. I know a lot of organizations in Pakistan who are working on maternal health and reproductive health and family planning. So, you know, their objective is determined. So you apply for the grant for that objective. There is an organization called Nutrition International, Canadian organization. So they give you the grant for the diarrhea prevention in Pakistan. So these are the objectives basically. For example, we say that diarrhea is one of the major killers for a child 5 years of age. So, you know, they give you the grant, the money, the fundings to address that issue.
Hello? Yeah, you're fine. Actually, I might not be able to actually define what I'm trying to ask. Like, let's suppose you wanted to do something. First, what you have to do is to have an idea about that particular thing that you wanted to do, objective. And then you create a proposal for that particular objective. And then to acquire the result, you have to implement that particular idea on the ground. So what's the missing link is the money that you wanted to have to actually implement that particular project. You know, it's a whole cycle. You have an idea, objective, or some novel kind of a thing that you wanted to do. You develop a whole proposal for that particular thing. And then you look around for certain agencies or organizations that those agencies would be interested in funding that particular idea. What people actually do is actually first they try to find out the funding, and then they develop the idea, which is not the right thing. In whatever field that you are working in, let's suppose infectious diseases or what, HIV or something like that, you have, as for your like observations and practice, you come across certain idea that is very novel, nobody has, or not in a major sense have done something for that particular thing. You develop an idea, you develop the whole protocol, you know, objective methodologies and all those things. And then you will look around organizations which are actually interested in funding HIV's kind of a topic. What people actually do, they look at the funding organizations and see, oh, there's a diarrhea or non-communicable disease. Oh, let's develop certain project in that particular thing, and you know, to get the money. That's not the right idea, which is one of the slides that, because you know there are certain, at that particular point I wanted to discuss about certain major international organizations that point. But since my laptop is not connected with this, there are certain file that is linked with that particular link. So I'll share. So there are so many organizations, thousands of those organizations, international and local. You know, there are certain Pakistani organizations that also funds those things. HSA and all those organizations, I have a complete list of it. because the idea would be to actually have the list of those organizations which actually fund in your area of interest, and then reach out those organizations after developing the idea. So in that particular whole process, there are three major players or three major systems. The first one is system number 3, which is the funding agency, which actually funds that particular thing. Then that fund goes to your institution or organization, and that institution or organization funds the team or the research investigator that actually. So this is the cycle. This is the three systems that actually work in that particular organization. Okay, let's talk about the reality. What's the reality of acquiring that particular money, which is not good? And there are the statistics for that. The rejection rate is around 80 to 90% of not having those funding. I'll discuss what are the main reasons and all those things. So, yes, only 20 to 10 to 20% projects get funded from those organizations. 80 to 90. Yes.
If I apply for the grant.
No. If your idea, we will discuss what are the reasons of being rejected for that particular thing. Because if somebody is giving you money, they have a very stringent criteria. I'll share because I have one example of ours recently. You know, we reached, it's a Canadian organization, Canadian Research Institute, which were funding with Wellcome Trust, they were funding for mental health. We proceeded till stage 2, which is quite difficult. And we have all the positive feedback from reviewers. We got rejected. I wanted to share that particular, correspondence and all those things to let you know, to clarify my point. By looking at those, by reading those reviewers' comment, it seems you'll get the funding. Excellent. Or 2 of them actually recommended for funding. And even then we got rejected at stage 2. Okay, so Horizon is one of the Europeans' largest funding agency. So the rejection rate in 2022 is, or the acceptance rate is less than 15%. Whereas for NIH, American NIH, is less than 20%. These are the statistics. So what are the things that the person should give ample time to writing hypothesis, research aim, budgeting, discussion with colleagues, and several round of feedback. A draft should be complete. Okay, fine. The thing that we discuss, don't chase the money. Okay? So if you chase the money, that because we don't have the expertise, and they may not have expertise, we may not have a novel idea at that particular time, because they are looking for novel idea and what your research and what your idea would contribute for the benefit of the community. They don't want to do the research for the sake of the research. They wanted to see whether that particular idea will have any benefit to the community, maybe certain devices or whatever. It could be anything, but it has to be novel and contributing something for the benefit of the community. Okay. So same thing, use your scientific clinical experience to prepare a project and proposal, and then find money to fund your vision. Or if you have never applied for grant, maybe the best to start is small. Don't go for very competitive, hi-fi kind of grants. Go for national level, small grants, which is easy to acquire, build your profile, and based on that particular profile, then go for big fundings. There are funding for early career individuals as compared to NIH and all those things, so go for that. funding opportunities. And then once you have your profile built up, then go for other big. So these funding opportunities does not come continuously. They have a cyclic kind of a thing. They have a particular dates in which they apply, they open their funding, and they have certain dates, they have certain deadlines for which you have to apply for that particular funding. So it's not a continuous process. So it follows a predictable repeating schedule. And from announcement of that funding and for submission of that particular funding till the result, it may go up to a year. Okay, so it's not a quick thing that you apply there. The funding that I'm talking about, it took us 18 months to get rejected. So it's not, it's a very tedious, a very patient kind of a thing. Very frustrating, very frustrating. But you need money, you know. You need money. We don't have money, especially in Pakistan. And I work in non-communicable diseases. So the funding is quite less as compared to the communicable.
I would also like to ask you, like maybe in the preceding slides, like what are the areas that are more favorable, not hostile, for the international donors?
Yes. So this is the one of the things that I have discussed. Let's discuss that particular thing since you have that particular question. Yes, because in Pakistan, our research is donor-driven. Okay? You know, the donor, if the donor is not interested in non-communicable disease, because non-communicable disease is not on their radar, because it doesn't spread, they have taken care of it. They know how to tackle that, those diabetes, cardiovascular disease, and all those things. It's your problem. So you better take care of that particular thing. Their problem is the infectious diseases. So most of the research now, after that particular Trump, they have slashed that particular funding even further. So USAID, because USAID is a parent organization which run different organizations. So, you know, even CDC has certain impact on that particular thing. We were working with UNICEF. So actually UNICEF also has an impact on that, and they told us that complete your project as quickly as you can, which were granted to us because we may close funding at any time. So these are, but still, there are funding. But funding is in maternal and child health. Funding is in HIV. Funding is in AIDS. Funding is in vaccines. Funding is in immunization. Funding is in diarrhea and all those things that you have referred. So yes, the fundings are there. So majority of those fundings are basically targeting communicable diseases, because the immunization is on top, and then vaccination, maternal and child are related to anything, maternal health, postpartum hemorrhage, and even all those things. So these are the area in which you have a slightly better chance of acquiring funding. So in area where they are interested in giving you money, they are somewhat lenient. And the other thing that I have discussed in my slide is that their geographical area in which they are interested. Most of the funding, they fund in Africa, because this is the area that they are very interested in.
I have an experience of working with an NGO. So even they tell you the geography in Pakistan.
Yeah, exactly.
This is the area that is
Exactly.
not
Exactly.
work in this area.
Exactly. So, and in Pakistan, sorry to cut you off, like in Pakistan, most of the funding is in NWFP or Khyber Pakhtunkhwa. Yes, yes. That's why, you know, the Khyber Medical University has millions of dollars in funding. They are doing a lot of research. They're also doing a lot of research, honestly, but they also have funding. Millions of dollars, Khyber Medical University. Because as you said, rightly said, that donors' interest is in that particular geographical area. So yeah, definitely. That's why we don't see much of the funding in Karachi, for Lahore, and all those areas. Even the organization, even as you have said, that NGO, they mostly work on those areas. Like they usually have one office in KPK. So that's why, because donors is interested in that area. So you have to look at the interest of that particular donor agencies too. Okay. So what are the core 4 phase of cycles, which we have already discussed, is the proposal preparation. Okay. So you have an idea, you developed a proposal and all those things. And then you apply. You submit your proposal according to the call of that particular agency, and then agency have a certain procedure of reviewing that particular process of that particular your proposal. So agency processing and review. So they evaluate the proposal's merit, and then they notify and give you the feedback on that particular proposal that you have submitted. And the 4th phase is, if your project or your funding got approved, the execution of that particular thing, of your project. And then, but you have to take care of those monies and all things. But if it is rejected, resubmission loop. If they allow you to resubmit that particular project. If they don't, then you may have to look at another agency. So this is the cycle. This is the cycle. Like, grant is not a separate thing. Grant, applying for the grant or writing a grant is part of a one whole process. Okay? So yeah, so that's the important thing. So applying for a grant is one thing, like preparing the proposal and the idea is the most important thing. And actually the budgeting, we'll talk about it. So this is the universal thing. So what they usually look for, which some of it we have already discussed, is they usually differentiate 3 Ps is one way of saying it. Like the lead person CV, the investigator CV. Let's suppose you are applying for diabetes, sir, and you are the lead person. So they will, very rigorously, look at your CV. What's your profile? What's your experience of doing research in diabetes? How many grants that you have acquired so far? How many projects that you have executed? And how many publications that you have done on that subject? That's the most. Let's suppose you may have a good idea, but you don't have that particular profile or a CV. Then there is a likelihood that you may not get that particular project. So that's the number one thing. So that look at the person's CV, their strength in that area in which they have applied for that particular grant. Then comes the project. So what's the strength of the project? As we have discussed, so is it a novel idea? It's a new idea, benefiting the community and all those things. And the other thing that they actually look for is the realistic budget. So if, let's suppose we are just writing the grant for the sake of money, they will rightly point it out. They will point it out, because we'll try to actually align our asking for money, the budget or the amount that they have actually announced. So let's suppose they have announced $1 million, and you are trying to make your budget till $1 million. There's very less chances that you'll get that particular thing, because they actually have, they are very senior, and they actually have their own reviewers. So they look at your project and they actually make their own budget, and they say that, oh, that particular thing can be done in $500,000. So why they have asking for $1 million? So yeah, so they have internal process. They actually look at the budget. So that's one thing. So it's not necessary that you have to make till $1 million. If your budget is, if that particular project can be done in your country in $500,000, just make $500,000. That's it. Then your chances of acquiring that particular grant is increased manifold. So that's the other thing. And then place, the thing that we have discussed, the geographical area. Let's suppose I'm applying from some ABC institute which does not have that particular sound environment of doing research, and they don't have that particular faculty and all those things, as compared to the other organizations that have a history of doing excellent research and things. So they have a right, they would have the high chances of acquiring that particular funding. So they actually look at that institute, they actually look at the profile of that institute and the organization and the geographical area in which they may be interested in giving funding. That's why, that university over there is having that much of a money. So these are few of the potential funder. So there are a database of finding those organizations that fund. So there are different organizations funding in different area of health research. There are certain organizations that may be interested in non-communicable diseases, infectious diseases, HIV, and all those things. So you can make a repository of those organizations which is like quite aligned with your interest of funding. So, and the good idea would be to make an Excel sheet, and they usually have a same cycle of announcing those funding. Let's suppose they announce funding in April. So they usually, or what their practice would be to announce that funding in April every year. So if you have that particular list and you know that there would be a funding coming up, then you can prepare your thing and your idea on that particular thing. The other would be, the good idea would be to network with colleagues and industry professional, attend funding workshops, university funding. So there are certain university which actually they have a seed funding or university funding which fund organization. So to this Sindh Medical University have certain funding or not to announce, to give to researchers or fellows. Sindh Medical University or JPMC, or are there any funding opportunities here? Okay, anyhow, so like I know about Aga Khan. Aga Khan have seed money, and they usually announce those rounds for the faculty and. Good, good. Yeah, Shalimar, if you have like, sorry, I don't know which organization, like are you affiliated with PIMA or? Mm-hmm.
I work for a clinical research organization.
Mm-hmm. Okay. Yeah, so why not? If you have any idea, just pitch that idea to. There is a research and innovation department in Shalimar, which actually do the research and all those things. Yes, why not? And it's not that if Shalimar will not have that particular money, Shalimar and your organization can look for that particular money for different pharmaceutical company. The pharmaceutical and DRAP actually have a lot of money, but they don't give it to individuals. Yeah. For clinical trials, we have like a separate clinical research and innovation. तो उसके अंदर कुछ साइट्स हमारी क्लिनिकल ट्रायल यूनिट के ऊपर अप्रूव है, और एक हमारा है जो हम डेवलप कर रहे हैं, वी आर डेवलपिंग सेंटर फॉर पब्लिक हेल्थ, जिसका मैं पार्ट हूँ, जिसमें हम डेवलप कर रहे हैं. तो वो एक अलग सेपरेट थिंग, तो हम वो कर रहे हैं. और यस, क्लिनिकल ट्रायल्स जैसे ज़रूरी वो नहीं है कि मेडिसिन का हर यूनिट ही क्लिनिकल ट्रायल की, कुछ यूनिट है. So this is the best of my knowledge, they are approved as per the clinical trial. So align mission and goals with that particular funding organization, what their goals are, what their interests are, in granting that particular thing. Then funding ensure that the fund will support that what you need. So the thing that we have discussed, that the amount that you would be interested in. Now let's talk about request for proposal. That ABC organization has announced for certain funding cycle, and they have asked for that particular request for proposal. It's a whole document. It's a very thing difficult, बहुत मुश्किल चीज़ होती है. Now, that particular RFP has two major components. Okay, so one is actually for organizational profile that we have discussed earlier. कितनी strong है, कितनी ज़बरदस्त है, उस एरिया में आपने कितना काम किया हुआ है. ये एक बड़ा चंक होता है उस RFP का, जिसके के अंदर होते हैं. और एक पार्ट होता है वो टेक्निकल, वो प्रपोजल that you are applying for, वो idea. So it has two major components. Information of your organization, profile, even financial strength of your organization, and if or whether your organization have acquired any funding before that. So you have to list down all those projects that you have done in that particular area, and then the actual proposal that you are submitting. So two major areas. So in that particular proposals or RFP, so what are the major things that they are actually asking for? Or the most important thing that you should be looking for is whenever they announce RFP, there is a whole document which actually tells you what this RFP is all about and how to fill that particular requirements to fill that particular thing. बाज़ औक़ात होता है कि वो सिर्फ they only allow NGOs, non-government organizations, to apply for that particular funding, or sometimes they actually ask for academic institute to apply for that. So you have to look for the eligibility of your organization. That's the most important thing. And after that, the other most important thing is to go to that particular, nowadays, पहले तो ये होता था कि आप you just fill that particular form and then you have to send the hard copy to that particular organization.
ऐसा भी हो सकता है कि आपका उनका जो eligibility है that is academic from university.
Yes.
But you are yourself is not an university. So can you be a partner to that?
100% इसी तरीके से करते हैं लोग, इसी तरीके से करते हैं. तो फर्ज करें कि आपकी कोई ऑर्गेनाइजेशन है लेकिन वो नॉट फॉर प्रॉफिट नहीं है, फॉर प्रॉफिट है, तो आप क्या करते हैं कि आप जिसके साथ किसी ऑर्गेनाइजेशन के साथ जिसके साथ यू हैव एन अंडरस्टैंडिंग और MOU साइन किया हुआ है आपने, सो यू मेक देम एज अ लीड ऑर्गेनाइजेशन एंड यू बिकम द इम्प्लीमेंटेशन पार्टनर. ओके, तो आप उसके थ्रू अप्लाई कराते हैं, काम सारा आप करते हैं, लेकिन क्योंकि एलिजिबिलिटी उसके पास है, वो कर सकता है, वो आपके साथ पार्टनर होता है, तो आप एक्वायर करते हैं फंडिंग, तो आप अपना जो आप इम्प्लीमेंट कर रहे हैं और जो सारा सब कुछ उसके ऊपर कर रहे हैं उसका आप शेयर ले लेते हैं, और जो उनका शेयर बनता है वो 75 आपका हो सकता है, 25 उनका हो सकता है, जो भी जिस तरीके से हो. कुछ इंडिविजुअल्स उनको सपोर्ट, तो वो जाहिर है कि उनकी वो जो बजट होता है तो उसके अंदर हर एक की वो कंट्रीब्यूशन इज मेंशन्ड दैट. सो यस, पीपल डू दैट, और तकरीबन हर ऑर्गेनाइजेशन इस तरीके से करती है. अगर वो खुद एलिजिबल हैं देन फाइन, एक्सलेंट, लेकिन उसके बावजूद भी वो बहुत सी हो सकता है कि उनके अंदर दे डोंट हैव दैट पर्टिकुलर फिजिकल रिसोर्सेज, so they partner with some other organization to acquire that particular physical resources. Like people usually, or the organization usually partner with government organization because they have physical structure. Let's suppose they wanted to do some research in primary healthcare. So no organization in Pakistan have that particular physical structure or physical resources as the government has. So they partner with the government and they acquire their physical resources and, you know, and all those things, and then apply for that particular health system research and all those things. So first and the foremost is to look at the eligibility criteria. Are you eligible? If not, as we have discussed, partner with somebody, collaborate with somebody. That's why, and they encourage collaboration. And the project scope, ensure your project fits within the funder focus area, understand the type of project they do not fund. Okay, that's the other most important thing. You also have to look for those projects that they do not fund, the idea that they do not fund, the objectives that they do not fund. You just have written that particular thing, and then at the last moment you find out, oh, fine, that's not their theme. So that's the other thing that you should be looking for. Then application requirement. Identify required documentation, information, notify any deadline and submission formats. You know, for the corporation or the corporate part or the organization part, there are a lot of documents that they actually require. You know, budget, financial documents, the human resource documents. So it's a lot of the documentation that you have to give to those funding agency as far as this corporate organization's profile is concerned. Same goes for the individual CV and all those documents to prove that you are something in that particular area. So yeah, your CV and all. And the application requires the other most important thing is the deadline. Okay, people actually just look at that particular and they say, okay, fine, I'll do it in that particular month or days or whatever, and it quickly passes by. So deadline, to remember the deadline, to mark it and start early as possible, because there's a lot of work and revision and feedback and all those things. So deadline is the most important thing. So get necessary information like organizational document, tax ID, financial statements, then project details, goals, objective, timeline, letters of support. Then develop internal timeline. Set, short timelines and the long timelines in which the internal deadline for drafting, reviewing, and finalizing the proposal. And then allocate time for gathering supporting documents and data. Then there's you usually make a team to actually apply for that particular thing. So you have a different individuals, you have clinician, you have biostatistician, you have epidemiologist, you have so many other relevant person in that particular thing. So from the beginning, you should make sure that every individual knows their responsibility, what their responsibilities are, and whatever time or the job or the assignment is assigned to them, they should submit that particular work on time. Because अगर एक आदमी भी पीछे लैग करता है तो पूरा आपका प्रोजेक्ट लैग कर रहा होता है. So that's the other thing that you should be looking for. And before starting to write, consider the following thing. This important thing to make your project unique for applying to that particular project is, why is my project important? How is it different from others? So you have to अपने आप से ही सवाल करने ज़्यादा से ज़्यादा. Uniqueness. And what resources do I need? It could be physical, it could be human resources and things like that. Do I have that particular human expertise to actually have that particular, or to conduct that particular research? If not, and then people usually do is that they actually borrow CVs from different individuals. Okay. So what type of grant do I need? So you have to list down all those organizations in which they are interested in your. So who can provide this type of funding and why should they fund me? That's the important thing. Okay, next time. So, yeah, so because you will not be the only person who applying for that particular funding. So it's not national, it could be like international organization that would be. So why your project get funded? You know, there are so many things that it all depends. It all, you know, as we have discussed earlier, that it should be novel. Okay, the idea is something that even though some people may have done it, but my area will benefit more from that particular idea. My community will benefit more, and I have that particular, let's suppose you wanted to do some research in diabetes. This is the main problem here in Pakistan. Let's suppose, because I've done that and have acquired funding for that. If you're working in cardiovascular diseases, let's say ischemic heart disease, what could be the novel idea that you'd be working, which will be different than the other individual? And the special thing over here comes through your literature search and your experience and all. The important thing over here is that we have premature ischemic heart disease as compared to other countries. We have heart disease, ischemic heart disease at a very younger age as compared to the Western population. On average, we have a heart attack at around 40s, 35, 40. Over there it is around after 50. So that's the area that you can propose and convince that individual that, look, people over here having it at a very earlier age, which is a productive age, they have that particular disability, they cannot earn, cannot be a productive part of the society and all those things. So that particular idea makes that idea different from other things. So I'm just giving you an example. So, and you know, I'm just giving an idea in the area that I work in. तो आप किसी और एरिया में तो आपको पता होगा बेहतर कि that point is something that is saleable. Okay, so it's convincing, and I can pitch that idea quite brilliantly to acquire that particular funding. Okay, so these are the things that you have to actually. It's creativity, it's your knowledge, your observation in that particular field.
Sometimes I've seen the disconnect. For example, HIV. I used to work for a pharmaceutical company way back. It was a multinational company. They put a lot of pressure on us to launch an anti-HIV product. So we did a lot of research and we found out that there is no HIV cases. There were very limited cases in Pakistan. So in spite of it, we were forced to launch that product in Pakistan. That was a big failure.
Because they may have got funding for that particular. Because donor is interested in doing research in HIV here in Pakistan, or they wanted to try a certain drug in certain individuals. You can do it quite easily, unfortunately, quite easily here in Pakistan as compared to some other. That's why, they have a lot of funding for Africa. I have discussed that point in one of my slides, political issues in acquiring funding. Funding agency have some political issues, some political alignment. So, उसकी वजह से भी आपको फंडिंग नहीं मिल सकती, जिस तरह आपने खुद एक. So, how to do that? Ways of writing a competitive proposal is start with a compelling executive summary. The catchy thing first. Right on target from the beginning. तो jargon कम से कम होना चाहिए कि बहुत ज़्यादा स्टोरी सुना रहे हैं इधर की उधर की और आपका उसके अंदर से आपका जो मेन पॉइंट है वो मिस आउट हो जाता है. So the compelling or to the point proposal have a better chance of actually, if the idea is right, of winning. Clearly define the problems and your proposed solution. Use data and evidence to support your case. So you should have certain data, certain references. अब जैसे मैंने बताया कि young adults में तो I should have that particular data, published data, which shows that yes, Pakistan has a high burden of ischemic heart disease in young adults. So I should have a data and numbers to support my claim. And then detailed methodology. Detailed methodology is something that should be feasible, that can be doable through that particular methodology. एक ऐसी चीज़ है जो कि आपकी केस कंट्रोल एग्जांपल देना, केस कंट्रोल स्टडी से बहुत अच्छी हो सकती है आपके सिनेरियो में, और द अमाउंट दैट दे आर एक्चुअली ऑफरिंग. Don't design a cohort study, okay, in that particular area, because it's very expensive, time consuming and all those things. So you have to look for that. So you have to have a good methodology written. So provide a step-by-step project plan, include timelines, milestone and deliverables. And those deliverables should be achievable, okay? So that's the most important thing. Highlight your team expertise. So we may be repeating certain things, but those are the things which are quite important. So you should have a very competitive team, highly qualified team to apply for that particular funding, and to biographies of those individuals. Then develop a realistic budget. The same thing that we have already discussed, that it should be realistic. If your studies can be done in $500,000, don't ask for $1 million. You will get rejected. Okay. So be realistic in that particular sense. So research plan budget should be allotted 2/3 of the time. And actually those funding agencies give you a guidelines. How to write that particular proposals, what are the different requirements, what are the documents that they actually need for that organization. To follow the funders guideline, adhere strictly to formatting, page limits and submission structure. So again, be clear and concise, avoid jargon, use straightforward languages. So focus on clarity. If a funding or the funding agency had certain ambiguity in their mind, they will not fund you. So you should be clear in letting your message across clearly without any doubt. And that's the art, actually. So without creating any confusion, if you can let that funding agency that what you want and they can understand clearly, high chances of getting that particular, if it is novel, again. And then explain demonstrate impact, explain the potential benefit and long-term impact of your project, use quantitative and qualitative support to claim. Then proofread and revise multiple times. So every time you proofread or revise, you may find something new in it. So don't just write one time and then submit. Just write your proposal and then proofread and have it read by different individuals in that area. So they may come up with certain different angle. So proofread and revise, give the time for that. So it requires certain time. So this is one article published in Pediatric Radiology in 2014, which actually discussed the different aspect of research and what are the requirements, is like research detail, research title, lead applicant detail, lead applicant CV, co-applicant, research development office, history of the application. So, which we have already discussed. Then who owns the intellectual property, finances. This is something that I wanted to actually give you a feel of how would you apply and what are the processes that you go through, which we have done recently. It's a grand challenge, Canada, a very competitive funding, and in collaboration with Wellcome Trust. They actually fund that in mental health. So we were part of one being initiative, which actually find out certain anxiety, depression, and psychosis in young adults. We were part of that initiative in which they have actually done situation analysis and have done reporting and all this. And after that, they actually announced those funding. So we were on that. Even then, we have gone through that process for 18 months. After 2 rounds, we didn't get the money. I don't know. If you could, I don't have that. So actually, I have shared the comments of those. We didn't understand. Because 2 of the reviewers actually recommended funding. Recommended for funding. 2 of the reviewers, in bold letters. I don't know. And then after first round, we went to the second round, submitted. I said sorry. And if you read the comment, we didn't understand. Maybe geographical area, maybe certain things that we were not able to make it very clear, because we wanted to actually have a novel kind of an idea that for school-going children, the theme for Pakistan was, negative relation or constrained relationship of parent with children. For that, which actually create anxiety and depression and psychosis, career choices and all those blah, blah, blah thing. So we actually proposed one project in which we actually had given them a digital intervention, because one of our collaborator was from Australia, who has a who was one of my supervisor for my PhD. तो उनके साथ किया, उन्होंने हमने डिजिटल इंटरवेंशन के थ्रू पेरेंट्स और चिल्ड्रन को थेरेपीज और उसको दी थी उनके रिलेशनशिप क्लोज करने के लिए. उसके बाद देन वी हैव गिवन, बिकॉज आवर ऑर्गेनाइजेशन हैज वन ऑफ द सेक्शन विच इज सेंटर फॉर आर्ट बेस्ड methodology and well-being. So through art we actually work with the individual to decrease this anxiety and depression. We actually incorporate, and people like that. Reviewers actually like that. But even then, we didn't get the money. So, yeah. So this is the documents of those things. So missing deadline, submit your application well before the deadline. And if you ignore the guideline, then guideline provided by the funding agency, then a less likely chance that you will get the funding. Then weak justification, provide strong evidence and rationale of your project, as we have discussed multiple times. And then overlooked budget details. Double check all budget items and ensure they are justified. These are the main reasons actually the people get rejected, or the proposal get rejected. Then final review, conduct a internal final review of your proposal for completeness and accuracy. Then submission, follow the specific submission process online. Majority of the funding are being submitted online nowadays. होता ये कि you started preparing the proposal. उनका एक रिक्वायरमेंट ये है कि सबसे पहले आप जाके ऑनलाइन अपना प्रोफाइल क्रिएट करते हैं, और वो प्रोफाइल अप्रूव होता है फंडिंग ऑर्गेनाइजेशन. शुरू में एक हमसे ये भी एक फंडिंग अपॉर्चुनिटी हमसे इस तरह सामने का प्रपोजल पे काम करना शुरू कर दिया, गाइडलाइंस देखी. बाद में हमें अंदाजा हुआ कि यू फर्स्ट हैव टू मेक अ प्रोफाइल, एंड दे एक्चुअली गिव यू अ डेडलाइन फॉर मेकिंग दैट पर्टिकुलर प्रोफाइल, विच इज डिफरेंट देन द डेडलाइन ऑफ सबमिशन. You first have to create your profile, your organization, your lead person, and blah blah blah. उनकी वेबसाइट पे बनती है ऑनलाइन, और उनका एक तरीका, उनके क्वेश्चंस होते हैं, फिर आप करते हैं, फिर आप डॉक्यूमेंट जमा कराते हैं, वो कहते हैं यू आर फाइन एंड यू हैव दैट पर्टिकुलर नंबर. फिर वो आपको एक नंबर दे देते हैं, प्रपोजल नंबर के. आप इस प्रपोजल के लिए आपका ये नंबर है, आईडी. तो अब आप फिर हर उसके अंदर फिर वो आईडी लिखते हैं, क्योंकि ये इन्होंने अब तरीका कर दिया है, मस्ट आपने करना होता है। अब तो वो AI को भी लेकिन हमें नहीं, हम तो वो पुराना कुछ कि ख़ासतौर पर कैनेडियन उनके जो था, तो आप सबसे पहले जस्ट try to find out if they have that certain kind of a requirement that you have to make an online profile on their website. So make sure to make a profile. Nowadays it is must. Confirm receipt of your application with the funder. Once you have submitted your application, don't wait it. Make sure that they have received your proposal. And don't assume. What they usually do is they give you a receipt of that particular application that you actually sent to them. और वो नंबर देते। बाज़ औक़ात या तो काम ज़्यादा होता है तो वो नहीं कर रहे होते हैं, या कुछ हिच आती है तो नहीं कर रहे होते हैं, और हम समझ रहे होते हैं कि हो गया काम। अगर आपको सर्टेन डेट में नहीं मिल रही है रिसिप्ट, call them or email them and make sure that they receive your proposal. क्योंकि ये कम मेहनत नहीं होती, आपके 3-4 महीने लगते हैं. You actually spend 3 or 4 months to prepare that. Then after submitting your proposal, contact the funder to confirm receipt and inquire about the review process, and then be ready to provide additional information if requested. Then stay organized, keep copies of all submitted documents and correspondence. Okay, those were the major points, not all of those, but those are the major points in actually writing a submission, what grants are, and how to write those grants and how to write a powerful, and what are the things that you should be looking for. I've just added those slides recently. The use of AI for the grants, and it's another whole topic, but just to give you a flavor of it, now AI is helping you to actually prepare your grant, submit your grant, and actually help you out. So there are two actually words that they actually use it. So one is like is human intervention, which is known as writer's intelligence, and another is artificial intelligence. So the use of AI in grant writing. So AI is not something that does that particular thing independently. The best use of AI is to have a partnership with AI. So to help you out in actually submitting that particular AI. So AI, use it as your assistant, as your partner in writing or helping to submit your grant. So the recommendation is that you should combine human intelligence with artificial intelligence for superior grant process. So the key strength of AI in that particular area for its speed and efficiency. It's a process that analyzes vast amount of information instantly. Repository of information, wealth of information, they can analyze that within seconds. जहाँ पे आपको महीनों और दिन और कितने लग सकते थे, वो आपको seconds में वो information provide कर देता है. So speed and reliability, efficiency. So they can identify relevant funding opportunities by analyzing data to find and match potential funding sources with your need. So through AI, you can search that particular funding sources quickly, which are actually funding or providing money in your area. And then identify opportunity to analyze data to find out, evaluating the competitiveness of your grant application. Then can provide recommendation based on historical data and predictive analysis. then uploading the request for proposal from which to pull request information, then analyze the requirement and matching them with potential reviewers who have relevant experience, creating accurate and comprehensive budget. They can help you out in creating budget or formulating budget for your proposal. They can help you out in literature review. They can help you out in making your objective more efficient. So generating draft based on predefined templates and guideline and they can proofread and edit your proposal as per the requirement of the funding agency. These are some of the AI tools that you can use in submitting or proofreading or whatever your proposals or your grant. Yeah, because they are actually defining. They don't have any problem if you actually take help of AI as an assistant, because they actually use AI to detect AI. Now, finally, 10 tips. These are not the only 10 tips or the tips that you can get. These are something that I find quite interesting. So these are the 10 tips for increasing your chances of receiving funding. So keep in mind that securing grant funding is a skill, not your good luck that has fallen upon you. So the first thing that I have emphasized earlier is that sleep, eat, and breath due dates. Make a note of it. Give a high priority of the due date. Start early. So don't sleep on it. So missed due dates are missed opportunities. It's not that they will call, okay, fine, we are extending our deadlines. They don't extend their deadlines. So once you missed your due date or the deadline, it's a missed opportunity. You have missed one opportunity to be in the race, at least in the race. And you don't get a second chance. So know the number of grants awarded. If a national fund is awarding only 10 grants, your chances of winning such a highly competitive grant award are slim. Okay, so to find out whether that particular granting agencies, how many of the grants that they are actually, if they are applying like only 10, 5, then your chances are quite slim of acquiring. If they are, so look around for those organizations who give a number of grant is quite high. So there, your chances of winning those grants would be high too. Then getting a handle on the previous type of grantees. So search around. They actually, those granting agencies, they actually have a list of those organizations whom they have granted the previous grants. So get a hold of that particular organization, talk to them, and try to find out what were their tricks, what were their projects, and how they actually have written their proposals, which actually tells you what kind of a proposal those funding agencies actually approve. So that you can have a nick of it. You can have some idea. So these are the lines that I should be working on. They actually look for those particular things. So if you are lucky, you just talk to them, and then if they can share their grant application, that would be great, which they usually don't do it. They don't do that particular thing. But anyhow, there's no harm in actually trying that particular out. The same thing that we have discussed. Scout out the geographical location of previous grantee. So they have an interest for certain areas. So look in which area they have actually granted those previous grants. So you would have a predictor, oh, they don't grant those funding in Pakistan, even though they call like low and middle income countries, but they don't usually give those funding to Pakistan. So that would give you some idea whether you have to actually go through that particular exercise or not. So match your request to the award range. You pay attention to the funder's grant award funding range or limit cap. Don't exceed or don't go till that particular thing. Be realistic. If your project can be done in a lesser amount of money, just stick to that particular lesser amount of money. Okay? And then, so make your background and capabilities count. Human resource, physical resources. So make a good profile of it. Have those individuals who have that particular capacity or expertise in that particular area. So make them count. Make a strong profile of your organization. So people don't usually put a graphic or tables in their proposal, which is not a bad idea to include in that particular thing, because it increases the quality of your proposal, understandability of your proposals. The other thing is that make partnerships, collaborations. So funding agency actually promote collaboration. So if you have a multi-collaboration, multi-support project submitted, it's a high chance that you will get that particular thing. Okay? So they know that if you are applying for a big project, it cannot be done by one organization or one or two individuals. Then pay attention to politics. Same thing, local, regional, and national politics seems to have found a resting place even among funders that we have discussed. That yes, politics do play, because what funding agency would like that, let's suppose they have given some previous funding to certain organization, they feel comfortable with that organization, and that organization will submit any new proposal. They are quite comfortable with those individuals, so they may grant that. There's one point that they actually look for that thing, so they may grant that proposal to that individual. And then keep in contact with funder. After you turn in your grant application, you need to develop a schedule for contacting potential funders. So keep in touch with those individuals. After you submit, just don't forget that proposal. Just keep on them. And then if there are certain delays, ask them what the delays are for. And yeah. So they actually assign a certain person to actually look for that. And they give the contact details of that individual. And they encourage to actually ask questions. So these are some of the points that if you can look at it, there is a high probability that you may increase your chances of acquiring funding. So the poor application may have weak or trivial hypotheses that I have emphasized so many times, that you have to have a very clear, achievable objective, noble idea, should be targeted towards the benefit of the community, not for the sake of the research only. So the poor application may have a trivial hypothesis, an inadequately detailed description of the research plan, or proposal which lack idea, insight, or collaboration. So these are the main sources which actually reduces the chances of acquiring funding. So this is some of the area or summary of how to acquire, what are the good proposals, what we mean by grant, and what are the things that you actually look for acquiring the grant, and what are the weak grants. So that's it from my side. Any question? A lot of questions. So you have actually made my life quite easy. جو انسٹیٹیوٹس ہیں بڑے انسٹیٹیوٹ وہ اپنی فیکلٹی کو مدد کرتے ہیں ٹو ایکچولی ہیو دا, بیکاز اٹس ناٹ اونلی دیٹ ریسرچرز از ایکچولی ہیونگ سم تھنگ, اس سے انسٹیٹیوٹ کا بھی تو بہت بڑا فائدہ ہوتا ہے نا. انسٹیٹیوٹ کے اوپر رینکنگ, اور جو ویسٹ میں ہم بات کر رہے ہوتے ہیں تو ویسٹ کے اندر تو وہ تو فنڈ اپلیکیشن. اور دوسرا اگر چلے ایک اور نظریے سے دیکھیں نا, ایک مارکیٹنگ ٹول بھی تو ہے. ابھی ہم بات کر رہے تھے کہ پاکستان میں سب سے زیادہ فنڈنگ خیبر میڈیکل یونیورسٹی کے پاس ہے, سب سے زیادہ فنڈنگ ہے.
اچھا,
تو کیوں؟ کیونکہ ایک تو چلیں نہیں خیبر میڈیکل یونیورسٹی آغا خان کے بعد چلیں وہ کر لیتے ہیں, کیونکہ آغا خان بہت زیادہ ڈسکلوز نہیں کرتا اس کے پاس کتنی فنڈنگ ہیں. لیکن خیبر میڈیکل کالج کے بعد میں ان کی بات کر رہا ہوں. آغا خان ایک ریناؤنڈ نام ہے نا بڑا. خیبر میڈیکل یونیورسٹی ایک پبلک سیکٹر یونیورسٹی ہے, آغا خان ایک پرائیویٹ سیکٹر یونیورسٹی ہے. اس کے پاس اتنا اماؤنٹ ہے کہ وہ باہر کے لوگوں کو تو اپنے ڈینز اور وہ ہائر کرتا ہے, ان کے تو اپنے کانٹیکٹ اتنے زبردست ہوتے ہیں. ہم بات کریں خیبر میڈیکل یونیورسٹی, ملینز آف ڈالرز ہیں ان کے پاس.
لیکن وتھ رسپیکٹ میں نے سوری آپ کا اتنا سنا نہیں, ہمارے ایک کولیگ جان ہاپکنس میں جو ہمیں آ کے ریسرچ پڑھاتے تھے, ڈاکٹر رزاق, ہی از اے ایمرجنسی پرسن آلسو انٹینسوسٹ. وہ کہتے ہیں کہ مجھے جان ہاپکنس نے 3 مہینے کی تنخواہ دی تھی صرف فرسٹ 3 months. Thereafter I have to earn my own from research.
بالکل, کیونکہ ٹینیور ٹریکس ہوتے
ہیں. And not only my own, میری پوری ٹیم کی, میری آفس کی رننگ کی, ایوری تھنگ. تو اتنی ریسرچ لینا مینڈیٹری ہے میرے لیے, ورنہ میرا سروائیول نہیں ہے.
وہ ٹینیور ٹریک ہے نا, وہ تو آپ نے
تو یہ جب تک ہمارے بچوں میں ہمارے بچے بیٹھے ہوئے ہیں, تو آپ جب تک یہ نہیں سوچیں گے کہ ریسرچ از سروائیول, وی وونٹ بی ایبل ٹو موو فارورڈ. That's the thing. اگر ہم اس میں پیچھے ہیں تو ہم ویزیبل نہیں ہیں, ہم ایگزسٹ نہیں کرتے. اینڈ ان گڈ جرنلز, ناٹ جسٹ کہ جب پروموشن کا ڈیڈ لائن ہو تو ادھر ادھر سے چھاپ کے. ابھی ہمارے ایف سی پی ایس نے اس کو مینڈیٹری کیا, اسٹیشن کو لڑکیوں کو بتا بھی دیا کہ آپ اپنی ڈیزرٹیشن لائیں. تو میں نے لڑکیوں کو کہا ایک اسٹیشن تو آپ کو 100% مارکس لیں گی نا, یہ تو آؤٹ ہو گئی اسٹیشن تو آپ کی. still didn't know کہ یہ اسٹڈی ڈیزائن کیوں ہے, کوہورٹ ہے تو کیوں ہے, یہ والی ہے تو کیوں ہے, امپیکٹ کیا ہے, because they were just doing or giving somebody some money to do it. 4 سال میں ریسرچ نہیں کی, 2 پیپرز چھپوا لیں اس وقت تو کتنا اچھا ہے, اور ایک اسٹوڈنٹ لائف میں. So everybody think research, and whosoever has funding problem, I'm sure we can arrange something impactful. Sir, آپ
سب سے پہلے تو پروفیسر نگہت شاہ صاحبہ کا میں شکر گزار ہوں کہ وہ تمام گناہگو مصروفیات کے باوجود ایکیڈیمک ایکٹیویٹی میں لازمی پہنچتی نہیں ایکیڈیمک ایکٹیویٹیز میں کھینچ لیتی ہے اسے. دوسری بات یہ تھی کہ جو بتایا ابھی ہم نے نیشنل سروے کیا, پہلے ایچ ای سی نے ہمیں فنڈنگ دینے کی کوشش کی, پھر کہا کہ نہیں 2 کروڑ نہیں 20 لاکھ دیں گے, پھر ہم نے خود اپنے اس پہ کی, اب وہ لینسٹ میں ایکسیپٹ ہو گئی. $6,000 یعنی 17 لاکھ مانگ رہے ہیں. جو میڈم نے کہا نا 2-3 نے, اب $6,000 از اکول ٹو 17 لاکھ روپے. اور دوسری جو بات میں کہنا چاہ رہا تھا کہ یہ جو چیزیں ہیں کلینیشین کے پاس ٹائم ہی نہیں ہوتا. دیر شوڈ بی کوآرڈینیشن بٹوین کلینیشین اینڈ نان کلینیشین, ادروائز یہ جو ہے. میرے ابھی حال ہی میں ایک ریسرچ میں رہ گیا کہ جو رشیا, چائنا اور پاکستان کی ہو رہی تھی کہ گھڑی کے ذریعے آپ کس طرح سے وہ بلڈ شوگر اور یہ مانیٹر کریں گے اور اسٹریس اور اس کو چینج کیسے کریں گے, یو کین ماڈیفائی دیٹ, اور وہ ہم سے نکل گئی ٹائم کی وجہ سے.
اسی لیے ریسرچ جو ہے وہ کولیبریشن ہے, کہ وہ ایسا نہیں ہو سکتا کہ ساری ریسرچ میں کر لوں, چاہے میں ریسرچر ہوں لیکن میں مجھے کلینیشینس اور ان کی ضرورت ہے, اور کلینیشینس بھی یہ نہیں ہو سکتا کہ وہ ساری. تو یہ کولیبریشن, اور جب تک ہم اس چیز کو ریئلائز نہیں کریں گے نا, ہمارے یہاں ریسرچ کا جو تھوڑا سا وہ ہے, کیونکہ ہم بہت ساری چیزوں میں آپ کی مدد کر سکتے ہیں, بہت ساری چیزوں میں, نہ صرف ٹریننگ کے اندر بٹ امپلیمنٹیشن آف دا ریسرچ, اور گائیڈ کرنے کے لیے, جو کہ میں جہاں بھی جاتا ہوں میں آفر کرتا ہوں کہ ہم اپنی آرگنائزیشن PSC گلوبل اور کے لیے فری آف کاسٹ نتھنگ, کہ اس میں ہم ریسرچ پروموٹ, ریسرچ کے جو کوشچنز ہیں ان کو لیے, ان کو ہم امپلیمنٹ کس طریقے سے کریں گے وہ. اور دوسری چیز اس کے اندر یہ ہے کہ پاکستان گورنمنٹ کی بھی بہت ساری ریسرچ فنڈنگ اویلیبل ہے. NIH کی ایک فنڈنگ ابھی راؤنڈ گیا ہے جس کے اندر انہوں نے 2 سے 2.5 کروڑ روپے کی فنڈنگ کی ہے, اور بڑے براڈ تھیم تھے ان کے, اور وہ ہر سال अनाउंस करते हैं, तो वो एक अपॉर्चुनिटी, सिर्फ यही नहीं कि हम इंटरनेशनल बहुत डॉलर्स और उसके अंदर हम देखें, लेकिन हम लोकल फंडिंग को भी टैप कर सकते हैं. और
ये बात सही की जब मैडम ने कहा ना, पाकिस्तान की कैपेसिटी है क्लिनिकल ट्रायल की 2.5 बिलियन डॉलर की. इंडिया ऑलरेडी 7 बिलियन डॉलर हर साल कमाता है, हमारी कैपेसिटी है 2.5 बिलियन डॉलर की, और वो वैसे ही चले जाती है.
Thank you, Dr. Javed, for your valuable and informative session.